students, today we are going to discuss pharmacology of heparin, that is parenteral anticoagulant. Now heparin, also termed as unfractioned heparin, is a powerful and instantaneously acting parenteral anticoagulant with a molecular weight of 10,000 to 20,000. Now important to understand that the heparin is not a single molecule. It is a mixture of long polysaccharide chains and therefore it has a high molecular weight of 10,000 to 20,000. Now it's effective both in vivo as well as in vitro. Injected IV, it acts instantaneously. But after subcutaneous injection, anticoagulant effect develops after about 60 minutes. And commercially, heparin is produced from ox lung and pig intestinal mucosa. Now let's understand the mechanism of action of heparin. Heparin acts indirectly. Now heparin binds to a plasma protein termed as antithrombin 3. So heparin first binds and then activates antithrombin 3. Now this antithrombin 3 is a plasma protein that inactivates several clotting factors. So heparin binds to antithrombin 3 and forms a complex. Now this heparin antithrombin 3 complex binds to several clotting factors of intrinsic pathway and common pathway, and this complex then inactivate these clotting factors. Now in order to understand the mechanism of action of heparin, let's first recapitulate the process of coagulation. Now, as we all know, coagulation is initiated by two pathways, that is intrinsic pathway and extrinsic pathway. Now, both intrinsic and extrinsic pathways, they activate clotting factor 10 to clotting factor 10A. So let's understand, or let's recapitulate the process of coagulation. Now, as we all know, clotting is initiated by two pathways. That is the intrinsic pathway and extrinsic pathway. Let's first talk about the intrinsic pathway. Now, intrinsic pathway is initiated due to internal injury to the wall of blood vessel. Now, due to this injury, subendothelium is injured, collagen is exposed. Now, platelets, when they come in contact with this collagen, they get activated. Now, these activated platelets, they activate the clotting factor 12 to 12A. Small a stands for activated. So this is the activated clotting factor 12. Now 12A further activates 11 to 11A. 11A further activates 9, clotting factor 9 to 9A. And this clotting factor 9A, it forms a complex with the activated clotting factor 8, that is 8A. And this complex further activates clotting factor 10 to 10A. So all these clotting factors, they function in a cascade, they function in a sequence, and finally in the intrinsic pathway there is activation of clotting factor 10 to 10A. On the other hand, extrinsic pathway is initiated due to external injury to the wall of blood vessel, say because of an accident, because of a trauma. Now this injured blood vessel wall, it releases a clotting factor 3, that is the called as tissue factor or thromboplastin. Now this tissue factor or thromboplastin, it is released in the blood. Now this tissue factor or the clotting factor 3, it activates the clotting factor 7. So clotting factor 7 is activated. Now it is termed as 7A. And further, the tissue factor, it complexes with the clotting factor 7A, and this complex activates the clotting factor 10 to 10A. So finally, both intrinsic and extrinsic pathway, they activate clotting factor 10 to 10A. And this is followed by the common pathway, that is a pathway which is common to both extrinsic and intrinsic pathway. So now let's talk about the common pathway. This slide shows the common pathway. So both the pathways, that is the intrinsic pathway and extrinsic pathway, they activate the clotting factor 10. So this clotting factor 10, that is 10A, is the activated clotting factor 10. Now activated clotting factor 10, that is 10A, along with clotting factor 5A and calcium, activate prothrombin to thrombin. Now prothrombin is a clotting factor 2. Clotting factor 2 is activated to thrombin. Now thrombin in turn activates fibrinogen to fibrin. Fibrinogen is a clotting factor 1. So thrombin activates fibrinogen to fibrin. Now one thing very important to note over here is this, that fibrinogen is a soluble protein, while fibrin is an insoluble protein, and large number of fibrin monomers are produced, and these fibrin monomers, they join together to form a fibrin thread. Now activated clotting factor 13A then cross-links these fibrin threads, and cross-link fibrin threads, they form a fibrin mesh network. So a fibrin mesh network is produced at the site of injury, and this fibrin mesh network, it is laid over the platelet plug. It strengthens the platelet plug. Now the platelets, blood cells and plasma proteins, they all are entangled in this fibrin mesh network, and finally it produces a blood clot. Now this blood clot, it seals the injured site of the wall of blood vessel, and as the blood clot controls and prevents bleeding, and tissues of injured blood vessel wall, they start regenerating. So this is all about the coagulation of blood. So now we have understood the role of several clotting factors in the process of coagulation. Now coming back to the mechanism of action of heparin, as we had already discussed, that heparin forms a complex with antithrombin 3. Now this heparin antithrombin 3 complex binds to several clotting factors. This complex binds to the clotting factor 10A. This complex binds to thrombin, that is clotting factor 2A, then 9A, 11A, 12A and 13A. Now after binding of this complex with these clotting factors, all these clotting factors are inactivated, and this inhibits the process of coagulation, and that is how heparin acts as a very powerful parenteral anticoagulant. Now one thing important to understand, that the anticoagulation or the anticoagulant action of heparin is exerted mainly by the inhibition of clotting factor thrombin and clotting factor 10A. Now inhibition of clotting factor 10A requires contact between clotting factor 10A and activated antithrombin 3, whereas inhibition of thrombin, that is a clotting factor 2A, requires contact of thrombin with antithrombin 3 as well as with contact with glucosaminoglycan of heparin, so that there is formation of ternary complex. Important to understand that the thrombin is inhibited only when there is formation of ternary complex. Now in the ternary complex, this thrombin, it binds or it complexes with heparin as well as with the antithrombin 3. Now let's study mechanism of heparin in detail so as to understand it properly with the help of diagrams. And now this slide explains mechanism of action of unfractioned heparin, that is heparin, another anticoagulant, that is a low molecular weight heparin, and Fondaparinux. Now as we all know that heparin is not a single molecule, it is a mixture of long polysaccharide chains. So this is one of the polysaccharide chain of heparin, that is unfractioned heparin. Now this long polysaccharide chain, it is made up of 5 sugars, 1, 2, 3, 4, 5, shown here in the purple color. So this is a pentasaccharide sequence which is made up of 5 sugars, and this is a pentasaccharide sequence which binds to antithrombin 3, which induces conformational change in the antithrombin 3 and which activates antithrombin 3. Now apart from this pentasaccharide sequence, the heparin polysaccharide chain consists of glucosaminoglycan. So this is the glucosaminoglycan part of the polysaccharide chain. So this is the heparin. Now heparin binds to the antithrombin 3. It is the pentasaccharide sequence which binds to antithrombin 3, activates antithrombin 3 and induces a conformational change in antithrombin 3. Now this conformational change in antithrombin 3, it enhances the ability of antithrombin 3 to bind with the clotting factors, namely clotting factor 10A and clotting factor thrombin. So this complex of heparin and activated antithrombin 3 further binds to the clotting factor 10A, that is activated clotting factor 10. Now here as shown in the diagram, this heparin antithrombin 3 complex binds to the clotting factor 10A. Now this results in the inhibition of clotting factor 10A. Now very important to note over here is this, that inhibition of clotting factor 10A takes place as soon as this clotting factor comes in contact with the activated antithrombin 3. However, the mechanism by which thrombin is inhibited is different. Now, when we talk about the inhibition of thrombin, it is the heparin antithrombin complex that binds to the thrombin. Now, what happens is this, that the heparin changes its conformation. Now, when it changes in conformation, it is the long glucosaminoglycan of the heparin that comes in contact with the thrombin. So now the thrombin is in direct contact with the activated antithrombin 3 as well as with the glucosaminoglycan of the heparin, such that there is formation of ternary complex. So formation of ternary complex, that is complex between antithrombin 3, then thrombin and glucosaminoglycan of heparin, is essential for the inactivation of thrombin. That means thrombin is inhibited only when it comes in contact with the heparin as well as with the antithrombin 3. Now, this is the structure of low molecular weight heparin. Low molecular weight heparin is the fraction heparin. Now, it consists of a short polysaccharide chain. So, this is one of the polysaccharide chain of low molecular weight heparin. Now, this chain consists of the same 5 sugar sequence termed as to be the pentasaccharide. Now, this sequence, pentasaccharide sequence, when binds to the antithrombin 3, it induces conformational change in the antithrombin 3. Antithrombin 3 gets activated and it's binding, and there is enhancement in its ability to bind to the clotting factors. So this is the formation of complex between low molecular weight heparin and antithrombin 3. Now this complex then further binds to the clotting factor 10A. Now, as is clear from the diagram made over here, that this clotting factor 10A, it comes in contact, it directly comes in contact with the activated antithrombin 3. So there is inhibition of clotting factor 10A. However, it's very important to note and it's very important to understand that low molecular weight heparin cannot inhibit thrombin. Since low molecular weight heparin are too small, their glucosaminoglycan is very short, the chains are very short, and these low molecular weight heparin, they are unable to form the ternary complex with the thrombin as well as with the antithrombin, and therefore these low molecular weight heparin, they can inactivate or they can inhibit only clotting factor 10A. They cannot inhibit thrombin. Similar is the case with the Fondaparinux. Fondaparinux is a synthetic pentasaccharide, and when it binds with the antithrombin 3, it activates and induces a conformational change in antithrombin 3. So this activated antithrombin 3 further comes in contact with the clotting factor 10A. So this clotting factor 10A is inactivated. But again, since this Fondaparinux, it is a very short structure, it consists of only pentasaccharide sequence, and it is not having the glucosaminoglycan, therefore ternary complex cannot be formed. So Fondaparinux cannot form the ternary complex with thrombin and antithrombin, and thus Fondaparinux also is unable to inactivate thrombin. Now, thrombin and clotting factor 10A are inhibited as soon as they bind with heparin antithrombin complex, and the anticoagulant effect of heparin develops quickly, almost instantaneously after intravascular administration. Now, let's talk about the pharmacokinetics of heparin, that is the unfractioned heparin. Heparin is a large, highly ionized molecule, and therefore it is not absorbed. Now it acts instantaneously after intravascular injection, and it produces its effect. Anticoagulant effect is produced within 60 minutes after the subcutaneous injection of heparin. Now heparin does not cross the blood-brain barrier, and it also doesn't cross the placenta, and therefore it is the anticoagulant of choice in pregnancy. Heparin is metabolized by heparinase, an enzyme called as heparinase in the liver, and fragments are excreted in the urine. Half-life of heparin is about 1 hour after the intravascular injection. Now after subcutaneous injection, the bioavailability is inconsistent. Now when we talk about the plasma protein bindings, heparin binds non-specifically to plasma proteins as well as to the mononuclear cells and endothelial cells, and therefore the plasma levels of free heparin are highly variable, and this requires monitoring of heparin when it is administered, when it is given to the patient. Now let's discuss the therapeutic uses of heparin. It is a preferred anticoagulant drug during pregnancy, as it does not cross the placenta, and as we all know that it has a rapid onset of action almost instantaneously after the intravascular injection, and therefore it is a preferred treatment for acute DVT, that is a deep vein thrombosis and pulmonary embolism. Now heparin is used for patients undergoing open heart surgery and renal dialysis. Now during these procedures, heparin prevents coagulation in various equipments and devices used during the procedure, for example heart-lung machine, then dialyzers, etc. Then the low dose therapy of heparin is used to prevent post-operative venous thrombosis. Now heparin may also be used for treating disseminated intravascular coagulation. It is a very complex disorder in which fibrin clots are formed throughout the body, throughout the vascular system. So heparin is very useful in treating this problem. Now heparin is also used as an adjuvant to thrombolytic therapy for the treatment of acute myocardial infarction. Now very important, let's talk about the adverse effects of heparin. Now the principal adverse effect of heparin is the bleeding, and this bleeding occurs in about 10% of the patients due to the overdose of heparin. Now bleeding is manifested as hematuria, that is the blood in the urine, then gingival bleeding, epistaxis, that is the bleeding from the nose, hemoptysis, melena, that is the blood in the stools because of the hemorrhage or bleeding in the upper GIT. Now severe overdose of heparin can be treated with the protamine sulfate, that is a heparin antagonist. Now another very important adverse effect of heparin is the heparin-induced thrombocytopenia. Now this is a potentially fatal side effect, and but it is rare. So it is potentially fatal but rare side effect of heparin. Now it is thrombocytopenia, therefore it is characterized by the reduced platelet count, and it typically occurs 4 to 10 days after exposure to the heparin. Now this heparin, now what happens, how this heparin results in thrombocytopenia, let's talk about this in brief. Now heparin complexes with the platelet factor 4. Now these platelet factor 4, they are found to be located on the membrane of inactive platelets. So the heparin, it complexes with the platelet factor 4. Now this complex of heparin and the platelet factor 4, it becomes immunogenic, and therefore IgG antibodies are produced. Now these IgG antibodies, they bind to the complex. That means these IgG antibodies, they bind to the complex of heparin and platelet factor 4. And this results in the activation of platelets. So those platelets which were earlier inactive, now because of the complexation, these platelets, they become active. Now we all know that when the platelets become active, they start aggregating, and therefore this results in the formation of platelet plug, and therefore there is clotting, and when the clotting is inside the body, it is termed as thrombosis, and thrombosis can result in deep venous thrombosis, it can result in stroke, myocardial infarction, and all these problems are fatal. Now, apart from this, this complex of platelet factor 4, heparin and antibodies, that is immunoglobulin G, this complex, it is this immunogenic complex, it is destroyed in the spleen. Now, this complex is excessively produced, and this is then further excessively destroyed in the spleen, and this results in the destruction of platelets, and therefore it results in thrombocytopenia, and the disorder is termed as heparin-induced thrombocytopenia. This is fatal, but it is a rare disorder of heparin. Some other side effects of heparin are transient and reversible alopecia, then osteoporosis on long-term therapy with heparin, then rare hypersensitivity reactions like urticaria, fever and anaphylaxis. So this is all about pharmacology of heparin, that is the parenteral anticoagulant. Now, if you find the video helpful, kindly like, subscribe and share this video. You can ask your questions by writing in the comment section, and I will answer all your questions. Thanks for watching the video.